Hi, welcome to Chirico Physical Therapy and Wellness. Today we're going to go over the best treatment for wrist or hand pain and or numbness. This is essentially if you're struggling with this and or you've got reoccurring problems with it from failed previous treatment approaches, just keeps coming back. The most important thing and where to start with this is to solve the root cause of the problem and not chase the effect but chase the cause. A good example of this is if there's a fire in your house, the first thing you do is get up and go room to room to find out where the fire is. And then after the fire is put out, you would go over and shut off the alarm. Well, the body's the same way. The body's fire alarm is when it tells you you have pain or numbness. It's telling you that there's something wrong. It's not telling you, though, what's causing it. And it's up to us to solve what's causing it and where it's really coming from. Because it's not always where you feel the pain and or numbness. And that's what fools a lot of people. This is important because if you solve where it's coming from and provide treatment for that, then the pain will go away, resolve, and it won't come back. It won't be reoccurring, and you'll have the best outcome possible. And that's what we want. We want you to get better. You know, even though we we love our patients, we want you to get better and not have to have us for life. So let's go over some of the possible causes, types and causes of wrist or hand pain and or numbness that can occur. Now, the first one is a neck or cervical problem where there's some kind of compression or bulging disc or even a herniated disc that can occur and causes radiating symptoms down into the wrist and hand region. This is a perfect example of what we were just talking about. If this is the case and there's it's coming from the neck and you treat the wrist and hand, it's not going to help. That's chasing the effect rather than the cause. If it's coming from the neck, then it needs to be treated there, or you're just wasting your time. Another one, a second one that can occur is called thoracic outlet syndrome, which is a difficult one to diagnose, and it's below the neck but above the wrist and hand again. It's kind of in the clavicle and first and second rib region where there's compression on the neurovascular bundle that goes through there. It's particularly difficult to diagnose because it masquerades as other things. But we've seen that before, treated it, we know what to do for that, and had good results. The other one that can happen is at the shoulder. There can be joint problems that can radiate down to the wrist and hand. There can be nerve impingement problems that occur there. There's also neuropraxia problem that can occur there in the similar region but underneath in what's called the axilla or upper arm region or armpit area from prolonged compression on nerves that run through there. And then there's elbow issues that could occur that also radiate down to the wrist and hand. There's median and ulnar nerve impingement syndromes that can occur. Moving further down to the wrist, there's tendonitis that can occur and specific types of tendonitis. One particular one is called de Quervain syndrome, which we've seen a lot of and had good results with. The other issues that can occur are wrist and hand and thumb area, rheumatoid arthritis, osteoarthritis, CMC joint arthritis in the thumb is common. There can be trigger finger going on issues, and it could be carpal tunnel is another possibility, carpal tunnel syndrome. As you can see, there are many possible causes of wrist or hand pain and or numbness. If you're suffering with this, the first step is to solve the root cause. The best treatment is based on that because not all wrist or hand pain and or numbness is the same. The problem is people go into a standard clinic and get standard care where they've chased the effect and not the cause. People fail treatment or their symptoms reoccur, and that's unfortunate. But we hope that you found this video helpful, and if you're suffering from this or a friend, please feel free to share it on Facebook and give us a call if we can help you. Our number is 909-345-3370, and we'll get you in for a thorough evaluation. And I want to thank you for your time and wish you a good day. Bye-bye.